Supporting those who are ready. Vaccination is a very effective way to keep ourselves, our families, and our communities healthy and to stop the spread of diseases such as COVID-19. As a community health worker, you can provide people with trusted information about vaccination, encourage them to get vaccinated, answer their questions, and support and guide them through the vaccination process. In this video, we will focus on how you can identify and support those who are ready to vaccinate. We will describe how to encourage clients to choose to be vaccinated and to follow through with this. We will also outline practical steps to help people prepare for vaccination, guide them through the process, and monitor them afterwards. Identifying clients who are ready to vaccinate. As you have conversations with your clients about their health and well-being, you can begin to understand how they feel about the vaccination. Some may be vaccinated already, which is great news. Others may be considering vaccination, but have concerns or reasons for hesitation, while some may not be thinking about it at all. For your clients who have not yet been vaccinated, it is important for you to talk with them about the benefits of vaccination whenever you can. Another video shows you how to introduce vaccination, address your clients' concerns with empathy, and empower them to take action and be vaccinated. During the conversation, you will want to ask your client questions to assess and identify where they are on their vaccination journey using the stages of change model. We explore this model in another video. Once you know the stage that they are in, you can help them move forward to the next stage in the process. If your client does not want to be vaccinated, it is important to understand their reasons for hesitation or concern. You should continue to have regular conversations with them to understand and address their concerns, and to understand what might motivate them to move into readiness to vaccinate. If your client is considering the advantages and disadvantages of vaccination, you should talk through the risks and benefits honestly and provide input on how to best reduce the risks. For instance, if they are fearful about the side effects of the vaccine, you might tell them about the relatively short nature of the side effects compared to getting the illness, and how to best treat fever or body aches should they occur. This may prompt them to take the next step and choose to be vaccinated. Although you are gently encouraging your client to get vaccinated, it is important that they do not feel that you are forcing them. By making sure that they always feel like they have a choice and are in control of their decisions, they are more likely to be motivated to act. If your client moves into the next stage and is open to considering vaccination, you can help them explore their next steps. Work with them to plan where and when they can get vaccinated as soon as possible. Your client may change their mind, or they may shift between wanting to be vaccinated or not, and this is normal. You should continue to be patient and supportive while addressing new concerns or sources of hesitancy or misinformation as they come up. Preparing clients who are ready to vaccinate. People are more likely to follow through with their plans if they have enough information and know what to expect. If your client is ready to be vaccinated, here are ways that you can help them to prepare for their vaccination so that they follow through. You should be ready to provide your client with details on where, when, and how to get vaccinated. These instructions should be simple and easy to follow, as well as specific to your client's needs. If they have made a plan already, ask them to share what they intend to do so that you can assist them or follow up afterwards. Some people may have difficulties accessing a vaccination site, such as the elderly, persons with disabilities, those who cannot leave home, or individuals who do not have transport. Try to locate a site that is closer or more convenient for them. You could help them organize with friends or neighbors to watch their children or assist with transport to the vaccination site. You may also want to explore whether there are any mobile vaccination services available. Encourage family members, caregivers, and community members to support those who need assistance and accompany them to the vaccination site. Remind your client of any documents that they need to bring with them to the vaccination site, such as a vaccination card or a form of identification. Explain how the vaccination process will work. Commonly, it follows these 4 steps. 1. A healthcare worker will record their name and date of birth and will then administer the vaccination in their arm. 2. They will get a record or card with the details of the vaccination. 3. They will need to stay at the place where they got vaccinated for at least 15 minutes afterwards so that healthcare workers can observe them for any unusual reactions or side effects. 4. Remind them to ask the healthcare worker if they need more vaccinations and when these will be required. Follow-up vaccinations will boost their immune response. As you discuss the vaccination process, answer any questions your client may have regarding the vaccine, its safety, the risks, or the process. You will want to be prepared to address common myths or misinformation with facts and reliable sources of information. Finally, share what your client may experience after the vaccination and what they can do if these symptoms appear. The common side effects, such as fever, chills, and body aches, are generally mild and normal and indicate that the body is building protection against infection. To explore the common side effects of the COVID-19 vaccination, look at the video on vaccine side effects and adverse events. You will want to be sure to remind your client that if the symptoms do not go away after a few days, they should contact their healthcare worker. If they experience any adverse events or more serious symptoms, they should seek medical care immediately. This conversation is to talk through any difficulties or concerns so that it is easier for your client to follow their plan to be vaccinated. Remember that your client may continue to have hesitation or concerns about the vaccine, even if you have an informative and effective conversation with them. The key is to continue being available and open to talk about their concerns, provide them with valuable information, and help dispel any myths or misinformation. Offer your support as your client goes through the process. Each conversation may help them to move down a path towards successfully achieving vaccination. Supporting clients after their vaccination. After your client has had their vaccination, make sure to follow up with them to find out how they are doing and help them manage any concerns or side effects. During this conversation, you should check in on whether they will need another vaccine dose and help them to plan the best way to get this. Even after a person has been fully vaccinated, their body still needs some time after the vaccination to build up protection against the virus. The time needed depends on the vaccine type and whether it is the first or second vaccination. In general, this is approximately 2 weeks after they have been fully vaccinated. As all clients, vaccinated or not, are still at risk of contracting the disease, they should keep taking precautions to protect themselves as well as others around them. Remind your clients to wear a mask covering their mouth and nose. Avoid crowds of people and practice social distancing. Keep windows open for ventilation. Wash their hands regularly or use a hand sanitizer. Sneeze or cough into their bent elbow or a tissue. So, what can you do? As a community health worker active in your community, you are in a good position to share your knowledge about vaccination, as well as guide and support your community members through the vaccination process. Every day, as you interact with your community, you can 1. Continue to talk about vaccination whenever possible. Listen carefully to understand what your clients may be concerned about. Use the methods that you have learned to provide information, encourage them to choose to be vaccinated, and ensure that they follow through with this decision. 2. Make sure that you have the most up-to-date information about vaccine locations, transportation, and procedures to share with your clients. Think ahead about those individuals who may have unique challenges in accessing a vaccination site or in following through with the vaccination steps. You can plan to address these needs with the resources available in your community. 3. Be available to your client before they are vaccinated and also afterwards. Being vaccinated is not the end of the process. They may need support as they deal with possible side effects, a reminder to have their next vaccination, or encouragement to continue with COVID-19 preventative actions.